Good afternoon, everybody. This is Carmen Wabagijik-Nuchtai, Director of Health and Community Wellness. I have welcome to this week's Health Q&A. Today is Thursday, May 14th. I do have both health managers, so Amanda Wabagijik-Jordan, our Health Promotions Manager, and Lisa Grew, our Home Care Manager. And today we have a special guest, James Bolan. James Bolan is an addictions and mental wellness counselor with Maamwesying, North Shore Community Health Services Incorporated. And he will do a little, provide us with a little thing on Mental Health Awareness Month. And we also have an update from GIMA and Council. So GIMA and Council met earlier today and have revised the General Order Reducing Virus Spread. A revised order will be posted on the website tomorrow. The new order will eliminate the requirement that stops everyone from entering the community except for essential services, medical, or legal reasons. In essence, we are returning to the original border closure from about a month ago. However, we are carefully monitoring the situation and will take quick action to change things if needed. Your health is our greatest priority. Gatherings of 5 or more people is not permitted, and we encourage visiting to occur outdoors if possible. You should only gather with those within your immediate household. If people want to visit family, they must practice physical distancing and remain 6 feet apart. For example, stay on your lawn or go for a walk outside. GIMA Council will continue to ensure traffic will be stopped to ensure no one is entering to purchase tobacco. They ask that the gas station continue to sell gas to residents only. Stores will remain closed, and our team is working on a plan for the future. However, we will no longer stop our families from visiting the community. Oops, I should have deleted that piece. Please remember that all of the other orders remain in place. We will still ask you to stay home and stay safe if possible. Do not gather more than 5 people unless in the same household. Socially distance and stay 6 feet away from each other. Wash your hands and practice good hygiene. Protect our elders and vulnerable people. Please continue to stay home. Please use your best judgment and use social distancing or physical distancing. Here is a statement about cottagers. In terms of people who lease from us as cottagers in Panache, we also ask them to follow the same orders. While they can return to their cottages, we ask that they isolate if they are coming from outside of the northeastern Ontario for 14 days or until they have received medical clearance. We ask that they socially distance and do not have gatherings of more than 5 people. We will be issuing letters to cottagers with this information and will be setting up a checkpoint to advise them of the order. This checkpoint will be to hand out information in relation to the order and will be set up Friday afternoon, Saturday, and Sunday. So that is the update from GIMA Council. So please keep an eye out for the revised order that will be posted in the Tikmikshing Nishnabek's website tomorrow. So next we are going to move on to James Bolan. So welcome, James, and we'll you can talk about your Mental Health Awareness Month.
Miigwech. Ani bojo wabavangan and Dishnakash, Sudbury and Dojaba, Ajijak and Doda. My spirit name is Grey Wolf, and I live in Sudbury, and I'm from the Crane clan. My name is James Bolan. As Carmen said, I work with Maamwesying North Shore Community Health Services and Mental Wellness and Addiction Counseling along the North Shore. And I was sent some questions that asked about mental health, and I'm going to read to you what my responses were. So what is mental health? So the first things that came to mind was mental health is a measure of the psychological health of a person with consideration given to the presence or the absence of mental illnesses. And for myself, in terms of the medicine wheel, I think of one's mental health in terms of the level of balance between all of the quadrants of the medicine wheel. And I feel that when there is a balance, it reflects that a person applies himself or herself as necessary in their self-care and takes time to celebrate their humanness and their sacredness. I see the balance that one achieves and maintains in their medicine wheel as a foundation which equips them with the capacity to encounter, respond, embrace, and address difficult and trying situations as they arise in their life. When there is balance in the medicine wheel, it better equips one to be able to live and function in a fair and acceptable means where emotional and behavioral responses and adaptations are appropriate and respectful considering the situation at hand. There's much more to mental health than what I'm written here, but I hope this is something that helps to give a little bit of clarification. I was asked also how COVID-19 is affecting people overall, and I said in my response that I couldn't really generalize the overall effects except to say that most people are identifying this as being very surreal and unreal and hard to believe. There are many who are embracing this pandemic as a necessary cleansing, wherein people are recognizing and appreciating what is truly important in their lives. And there are many who hope that this will result in people being kinder, gentler, and more loving and respectful to one another, and of Mother Earth and of all of life. There are some who live with anxiety and fear of what's to come and the unknown that really scares them. And others are experiencing depression and isolation that they're experiencing. I see people amending, adapting, and adjusting their lives. Some are okay with it, and some are struggling. And part of what I try to do when I'm sitting with an individual and I'm able to receive the information as to what they're struggling with, I look at, in terms of the medicine wheel, if it's mental, emotional, or physical, and try to direct them accordingly. But I have found one of the most important things, and I truly believe, and it's been important for myself as well, as staying connected. I think that the connectivity that we have with one another as human beings helps us to celebrate our humanness and to also to bounce our ideas off and to express ourselves and to share what's going on with us, because a lot of us are going through similar things here right now. There's a question of what can somebody do when they are having a difficult time? And I wrote, reach out, reach out, reach out. Talk about it. Find and do things that help you to soothe your soul and rest your spirit, that bring you calm and initiate joy. Being kind to yourself. And I often say, you know, we're very quick to go out above and beyond the call of duty to help other people. And quite often we don't give that same kind of energy back to ourselves, and we need to be good to ourselves. We have to care for ourselves and be kind to ourselves. And that's not easy for many people, because they can be pre-consumed with, you know, the thoughts of what's going on out there and the fears that are associated and the anxieties. And then again, individually, I look at how can I help a person in terms of the anxiety. First of all, I want to help them to recognize it's really based on a fear that they're experiencing. And what is that fear? And is it real, right? And then helping them with regulating and balancing through either breathing exercises or cognitive thinking. It's important to let people know that they're not alone and provide them with phone numbers to call in times of need, so that there's always someone available. And one of the numbers that I often stress to people, if they're saying that there's nobody that they can call, is the number 211. It's an all Ontario access line that you can call that will direct you to where you are in your region, to an agency of support for whatever it is that you're calling about. But it's something that is little talked about, but is so important because it can save lives. Another question was about shame removal, closing statement about mental health. So I said, in my view, the only shame about mental health is on those who sit in judgment and criticism with their biases and their ignorance about mental health. Each and every person on this planet has their own uniqueness and individual state of mental health. I believe each of us should be celebrated for our uniqueness, for our differences, instead of being judged and shamed for our differences, for not fitting in, or for not being the normal. I think as very individually, we're all our own person, and Creator gave us our body and our spirit and our life to, I believe, do something with it. And we all have purpose here, and we all have meaning. And that sense of belonging is so important. And one of the most important things to have hope. And one of the most important things that I try to inspire, or at least to help people see, is that there is hope, and help to get them feeling that too. So that's how I answered my questions. And I hope that's sufficient for now, Carmen. Is that good?
Yeah, I think it was really good, James. Thank you for that. I also did, I was looking over some, I don't even know what I was looking over. But anyways, a few weeks ago, I came across a document that talked about anxiety. And it said to help yourself get back is really to look at the 3 threes. So look at 3 things that you see visually around you and name them. So I see a plant, I see a flower, I see a bird, and then name 3 things that you physically feel. So like I can feel the desk, I can feel the chair that I'm sitting on. I could say if I was outside, feel the wind on my face or something. And then something you can hear, 3 things, name 3 things that you can hear right now. So by bringing you back to the present, it helps you to overcome some of those anxieties or fears, because yeah, fear is based on the unknown, right? So awesome.
Yeah, very, very good points. And I want, if I could add to that, one of the things I've found since the Sacred Fire that we've been able to relight the Sacred Fire on Mondays there, there's it de-escalates. People are finding by connecting back with Mother Earth, being by the Sacred Fire, there's a calming that goes on with that, and the anxieties just come down. And I was just actually talking with one of the community members earlier today, and talking to her about anxiety. And one of the places that she finds that it really is at its lowest level, her anxiety, is when she's out with Mother Earth, walking in a field and also tending to a garden. So being active and you know, occupying yourself and doing something that's creative, or something that fills your heart and your mind with the feelings of goodness, is very helpful too.
Mm-hmm.
Yeah, Maamwesying. That's a really good teaching too about the 3 threes.
Mm-hmm. Yeah.
Good.
Okay, so thank you, James. We are going to move along to our questions. So I have both Amanda, Lisa, and myself will take some questions, or provide some questions with some answers and a little bit of information about those answers. So we'll start off with Lisa.
Hey, my first question, and these questions were just taken off of the internet, and they're just trivia kind of questions in regards to the coronavirus. So question number 1 is, how long does the novel coronavirus survive outside of the body? There's 3 possible answers. So A, a week in the air and on surfaces. B, several hours to days. Or C, up to 2.5 weeks. So the answer to that is B, it's several hours to days. And that's because it depends on what surface it's on. So it could be several hours up in the air to 2 to 3 days. And they're saying sometimes even up to 7 days on certain surfaces.
Mm-hmm. Okay, thank you. Amanda will have the next question.
Okay, so the next question was, what's more important for preventing infection? Was it A, frequent hand washing, or B, wearing a face mask? The answer is A, so frequent hand washing. The mask should only be worn by health workers, caregivers, and individuals with respiratory symptoms such as fever or cough, according to health authorities. And there's no conclusive evidence masks protect ordinary healthy people going about their daily business, although a few small studies have suggested that widespread use of face masks by the public may have reduced transmission and outbreaks of other respiratory diseases. So with masks in short supply, the argument is that everyone is better off if they are reserved for those, they are reserved for those who can't avoid exposure to people who are infected.
Mhm. And I believe the latest recommendations too for masks is if you can't stay within 6 feet physical distance, then you can wear a mask, and you can wear a handmade mask. So I think that's something that we'll be making more of in the future. Okay, next question. What percentage of people confirmed to have COVID-19 develop mild or moderate symptoms? A, 20%, B, 40%, or C, 80%? Answer is C, 80%. A joint investigation by the World Health Organization and China found that 80% of laboratory confirmed patients have mild to moderate diseases, which may include a mild form of pneumonia. Countries that are testing widely for coronavirus are finding that the number of infected people who show no or delayed symptoms may be greater than previously thought. Typical signs and symptoms include fever, dry cough, fatigue, phlegm, sputum production, sore throat, and headache. About 14% of cases are severe, causing shortness of breath and difficulty breathing. Critical cases, which account for 6% of patients, experience respiratory failure, septic shock, and/or multiple organ dysfunction or failure. So 80%. Lisa is next.
So the next question I thought was kind of neat for vocabulary, because I like to always try to learn something new every day. And the question is, what is a fomite? Or if you're talking about, you can ask what are fomites, and that's if it's plural. So the possible answers are A, a hospital grade disinfectant, B, a contaminated object or surface, C, a disease carrier, or D, an immunity boosting supplement. And the answer is B, a contaminated object or surface. So in regards to that, they're talking about the everyday places that you could touch, such as doorknobs or handles, the press buttons on elevators, or utensils that you use to eat. Yeah. So when you're talking about more than one, it's fomites.
Yeah, so that is a new word that we learned.
Yeah.
Fomite. Fomite is a
Yeah.
contaminated object or surface.
Yeah.
Okay, Amanda, next.
Okay, so how soon can a vaccine for COVID-19 be commercially available? Is it A, at least 12 months, or B, around 16 weeks? The answer is A, at least 12 months. It will take a year or more for experimental vaccines to undergo rigorous testing required for regulatory approval.
Okay, so I see James there. James, you want to do the next question?
You put me on the spot.
I know. Well, I didn't feel comfortable with you just sitting there, so I wanted to bring you
Okay.
back in. So
Right.
it's the one with the who's at the highest risk. I believe that's page 3 at the bottom.
Who's at the highest risk of developing severe COVID-19 disease? Okay, and I get to choose too, so I'm 50-50 here, right?
Yeah.
So A, children, B, people over 60 years of age, C, pregnant women, or D, those with existing medical conditions. So the answers are B, people over 60 years of age, and D, those with existing medical conditions. Did you want me to read the little blurb, Carmen?
If you would like to, James.
So people of all ages can be infected by the coronavirus. However, older people and those with medical conditions such as high blood pressure, diabetes, asthma, cancer, they're at a greater risk. Children are among those with the lowest risk of developing severe symptoms, yet emerging evidence suggests that infants and toddlers may also be at risk of severe complications. And data from the US and Europe show young people from 20 something to those in their early 40s are among those falling seriously ill. Unlike the influenza, COVID-19 doesn't appear to cause more severe symptoms in pregnant women.
Okay, thank you, James.
Welcome.
Lisa, you're next.
This question is, can my dog give me COVID-19? You could answer yes or B, no. And the answer is yes. And they're even starting to find now that dogs are catching this virus, whereas at the beginning they thought it was something that they would not catch and be able to pass on to people. But so now we have to watch out for our pets. And if you get sick, you don't bring your pets into bed and have them heal with you. You have to separate them and isolate them away from everybody else as well.
Okay, thank you, Lisa. Next is Amanda. Last question.
Okay, so can the COVID-19 virus spread in hot and humid climates? A, yes, B, no. That answer is yes. The evidence so far indicates the virus can be transmitted in all weather conditions. Seasonal flu tends to flare up in winter and recede as spring arrives, but health experts say that it is too early to know whether seasonal changes can or will affect a different respiratory disease in the same way, although there is some indication if it may.
Okay, thank you. Oh, those were some of the questions that we have thought up for this week. If there's any questions that you would like to know or have for us, please send them to communications@wlfn.com, and that's Bridget Prouse, our communications officer. So there's one last thing I wanted to take care of in this health Q&A this week, and it's just a reminder for the testing. So testing of COVID-19. If you're having any symptoms, either a fever of 37.8 degrees Celsius or greater, new or worsening cough, shortness of breath, sore throat, difficulty swallowing, any taste disorders, nausea, vomiting, diarrhea, abdominal pain, pink eye, or runny nose or nasal congestion, and that's not your allergies, that's separate. If you have any of those symptoms, please call the assessment center. And again, did I write down the assessment number? Okay, here we go. The number for the assessment center is 705-671-7373. So the assessment center phone number 705-671-7373. They will ask you some questions with regards to your symptoms, and they will make a recommendation for you if you need to go in for testing. They will provide you with directions as well as to what to do. So please be mindful of and take their direction. They are registered nurses that are taking all the calls and doing the triage over the phone. If you have any severe symptoms such as difficulty breathing, please call 911 and let them know your symptoms you're having and if you've had any travel or contact history. There are 3 places, assessment centers within Sudbury area. One on 56 Walford Road, which is open from 9 to 5, 7 days a week. Nemo Medical Center at 885 Pratt Street, open 8 till 4 p.m., 7 days per week. And the Primacy Medical Center, this is a drive-through testing facility at 1485 LaSalle Boulevard, open 11 till 9 p.m., 7 days per week. They do not take any walk-ins, so please make sure you phone the assessment center if you have any symptoms. Okay, so that's it for this week. I hope you enjoyed this week's session. Again, if you have any questions or any concerns, please call me or any of the managers, and we will get back to you and maybe feature it on the Health Q&A. Thank you.
Thank you very much.